Are you unhappy with the appearance of your teeth? Do you have gaps or perhaps chips on your teeth? If so, composite bonding is probably right for you. As a specialist dentist, I'm often asked about this very popular treatment, so let's take a dive into the risks and benefits of composite bonding. Composite bonding is a dental procedure that involves the application of a white, essentially tooth-colored dental material to the surface of the tooth. It's then shaped to create the most beautiful, optimal appearance of that tooth, and is then finally polished at the end to create a natural looking appearance of the tooth. One of the main advantages of composite bonding is that it's very quick and painless. In most cases, it can be performed in one visit without a local anesthetic, making it really comfortable for most patients and therefore dentists. However, there are some risks that you need to be aware of, particularly around the foods and the drinks that you have after composite bonding. You see, composite, so white filling materials, are more prone to staining and chipping afterwards. You may therefore need to avoid certain foods and drinks after you've had composite bonding. And if these are your favorite foods and drinks, we just need to be aware of this to start with. Examples of such foods include curries, red wine, certain teas and coffees. Another risk of composite bonding is that because the material itself is less robust compared with the alternative porcelain veneers, it is more likely to chip and break within 6 to 12 months of the original placement. You therefore need to be really careful with what you eat after composite bonding, and if you're the kind of person that grinds at night, you may seriously need to consider having a bite guard to just protect this really fragile material. Before having a composite bonding, it's really important that you have a detailed conversation with your dentist or your dental therapist, just to be aware of the issues that could arise afterwards. So for example, if you're like me that loves red wine, you may want to think twice about having composite bonding because it's more prone to staining. If you grind your teeth at night, then your bite would need to be carefully studied to assess the risk of breakage, and then you can have a conversation with your dentist or your hygienist about whether to have a bite guard. In summary, composite bonding is a really effective way of improving your smile. However, the question to ask yourself is, how much maintenance are you going to require afterwards? Are you going to need to avoid certain foods and drinks that might be unavoidable for you? And do you have certain habits, grinding at night, for example, which might make it more likely that you'll run into problems with dental composite? If you're therefore looking for a cost-effective, relatively quick way of improving your smile, composite bonding is certainly worth considering. If you choose to have composite bonding, in addition to dealing with or taking steps to avoid the risks I discussed earlier, it's really important that you are prepared to see your dentist or your dental therapist every year for maintenance and polishing, and for general checkups to make sure that you're not developing problems underneath the layers of dental composite. If you feel that composite bonding is the right procedure for you, please fill in the form below, and one of our friendly team would be only too happy to contact you as soon as possible to answer your questions. If you found this information useful, please like the video and share it with somebody else who might also find it useful. Please subscribe to our YouTube channel for more videos like this. Thank you very much.